Our course description, the Stony Brook Department of Orthopaedics would like to welcome you to this webinar. Throughout this presentation time, we will be educating the viewers on current best practices on the reduction of knee injuries among athletes of all ages. We'll provide information on preventative strengthening with the ACL prevention program and introduce the Stony Brook women's sports medicine team. Important reminder, I know there's a few people who are not looking for the educational credit, but for those of you who are, please make sure that you're logged in with your full name so we can verify with the attendance. If you're a student, feel free to put that next to your name. If you're a coach, an athletic trainer, a resident, a physician, whatever it is, it just helps us get to know who's viewing a little bit better. And if you have any questions, please feel free to send me a chat in our chat box and I'll be happy to answer what you may have. The meeting is being recorded for future use for the educational programs here at Stony Brook, so please make sure that your microphone and your video are off during the entirety of this presentation. Our objectives tonight will be to understand the current best practices on the reduction of knee injuries among athletes of all ages, to identify and implement the Stony Brook University ACL injury prevention program through multidisciplinary presentation via webinar. We want to identify the prevention program steps and understand how to implement them to ourselves and our athletes. Like I said, coming from all different practices, you can apply this where it's best fit. And we want to allow the community members to ask questions about novel ACL injury prevention program and to enhance their ability to implement such a program in their practice. Briefly, our accreditation through the CME School of Medicine. This webinar does qualify for a maximum of 1.0 AMA PRA Category 1 credits. Physicians should only claim the credit commensurate with the extent of their participation in this activity. To get your certificate through Stony Brook, please contact Donna or Myra at the CME office. They'll be sending the certificate to you after the webinar. Reminder for our physical therapists and athletic trainers who are viewing this tonight, the symposium qualifies for 1 contact hour for physical therapy and 1 Category A CEU for athletic trainers. For athletic trainers specifically, you have to send that evaluation form at the completion of this webinar to Christos, who runs the athletic training section of this for Stony Brook. Our disclosures here tonight are presenters George Green, BJ Arbolino, Dr. James Panna, Dr. Stuart Cherney, Dr. Brian Cruikshank, Dr. Kristen Hopkins, Dr. Megan Paulus, Dr. Samantha Mulrad, Dr. Diana Patterson, Dr. Ann Mayo, whew, that's a long one, have no disclosures for this evening. And just a quick reminder, Stony Brook Orthopaedics does offer an orthopedic urgent care with walk-in hours Monday through Friday at our 14 Technology Suite 11 site in East Setauket. You can see us for same-day care for sprains, strains, minor fractures, dislocations, and all sports-related injuries without an appointment. If you have any questions about this, please call our appointment line at 631-444-4233. Just a reminder that if you have questions, you can type them in the chat box at any time throughout this presentation. I do want to give Dr. Cherney the opportunity to introduce the Women's Sports Medicine Center team, and then to bring us into introducing our presenters for the evening. Dr. Cherney, the mic is all yours.
Welcome everybody tonight on behalf of Sports Medicine Program at Stony Brook University in our Department of Orthopedics. This presentation tonight is one of several that we've rolled out in support of our Women's and Sports Medicine Center as part of our outreach and educational program. The Women's and Sports Medicine Center is one that we're very proud of. We rolled it out just about a year ago, and just when we were getting going with it, we hit the COVID crisis. So now things are slowly getting back to normal, and we're going to start utilizing the resources that we have at Stony Brook in our efforts to focus on specific injuries and issues that female athletes, competitive athletes, young athletes, older athletes, recreational athletes are going to experience And of course, part of our effort, we draw heavily on the experience of our many skilled and expert orthopedic surgeons, PAs, medical assistants, physical therapists, and other specialists who themselves were college athletes and can relate to specific issues that they had as female athletes, and they particularly relate well to their patients. So about 2 months ago, as part of our educational webinar series dealing with specific issues that female athletes have, I did a presentation on the risks for ACL tears in female athletes. And those risks can be up to 3 to 8 times higher than their male counterparts. So we recognize and acknowledge the seriousness of ACL tears. It's a minor epidemic of sorts in the sports medicine field. At Stony Brook University, we've incorporated ACL prevention programs for many years. Our varsity teams have benefited from these programs, which can decrease the incidence of ACL tears in female athletes by up to 80%, as presented in some studies. Stony Brook's own strength and conditioning staff, along with our athletic trainers and physicians, have now fine-tuned our approach so that the athletes of all ages can benefit. Under the direction of George Green, Stony Brook Associate Director of High Performance and Competitive Success, tonight we present this concise and simple program. Special thanks go out to our senior and very talented athletic trainer, BJ Ercolino, who you'll see in the video. We really appreciate and value her assistance in this production tonight. Also, thanks to filmmaker, musician, Alex Cherney, who filmed and edited the video for us. So at this time, I would like to introduce George Green, and he will take over the rest of the presentation.
Thank you, Dr. Cherney. I appreciate everybody joining us tonight. This has been a really fun project to work on, and really excited to share it with you this evening. So just before we get started, I want to give you a little bit overview on what you see in the video tonight, and just paint a picture for everybody that might be coming from a little bit different situation. So we took the movements and progressions that we use with our student athletes at Stony Brook in the weight room with access to a ton of equipment and technology, and we condense that for the junior high school, the high school female athlete with limited resources and ultimately limited time. We know the high school student athlete might be playing multiple sports, is involved with a lot of other activities, and time may be an issue, and equipment might be an issue. So we took a lot of the exercises that we use normally in our weight room, on our fields, as part of our training process, and condensed those to be able to progress without the equipment that we might have at our disposal. I do want to note that this program really should be supervised by a coach, by a parent, by an athletic trainer who might be part of the team that's supervising the workout, in conjunction with the warm-up and a recovery routine as part of practice. Phase 1, you'll see initially on this program, is really designed for the junior high athletes and below. Those athletes really don't need to progress beyond phase 1. And then phase 2 and 3 are designed for the high school and advanced athletes. As they progress through phase 3, athletes can then begin to use equipment if they have it at their disposal, bands and weight training equipment, to increase intensity, to continue to make progress. But as I said earlier, this really was designed with a student athlete in mind at the high school level or below the high school level who does not have access to equipment. Following the presentation, we will have access to a YouTube link so you can rewatch this video. And I'm also getting a PDF together of this program that will have the sets, the reps, the rest periods, and things of that nature for you to have access moving forward. So thank you again for having me, and I'm excited for you guys to see the presentation. Thank you, Dana.
All right, going to switch over to the video for us. Just a reminder, if anybody does have questions throughout this video, you can feel free to type them in the chat box. I'll have a dedicated period after the presentations for anybody who thinks of other questions to ask them away, and we'll do our best with all our physicians that are on to help answer.
Hi, my name is George Green. I'm the Associate Athletic Director of High Performance and Competitive Success at Stony Brook University. Here to share with you an ACL prevention program for female athletes that we've been working on for years at Stony Brook University to help reduce the likelihood of injury. We've taken this program and condensed it and modified it in order to accommodate athletes at the youth level, at the high school level, who want to incorporate a training program they can do in conjunction with practice in their workouts. The exercises that we'll be sharing with you today are proven to increase speed, strength, power, and most importantly, help make you a more resilient athlete.
Hi, my name is BJ Ercolino. I'm an associate athletic trainer here at Stony Brook University, and the goal of our ACL prevention program is to eliminate as much risk as we can. We know we can't eliminate all the risk in sports, but we're trying to keep the risk for all athletes, primarily female, but this will also apply to males, as low as possible. We can't get rid of genetic factors, but if we can make you stronger, faster, more powerful, we'll keep you on the field longer and you'll spend less time with us.
I want to explain the 3 different phases that we have today. So in phase 1, it's for beginner athletes under the age of 12. It introduces a lot of these movements. It puts you in the right position, which progresses you into phase 2. Phase 2 is a progression from phase 1, so the exercises get slightly more advanced. If you have a setback or you have a couple weeks off, you want to revert back to phase 1 if you're deconditioned. So those two can be used simultaneously in some cases. Phase 3 is for the most advanced athlete who has progressed from phase 1 to phase 2 and is getting closer and closer to reaching their strength potential. So these workouts were designed to be done 2 days a week, day 1 and day 2, or separate programs. And athletes who want to push themselves a little bit further or feel like they have the time to be able to do it, they can do a 3rd day, choosing between day 1 or day 2. These workouts are designed to be done year-round, whether you're in season or in the off-season, and in conjunction with your pre-practice warm-up and recovery routines. So when you're completing this program, there's going to be assigned sets and reps given to each exercise. So as an example, for an eccentric bodyweight squat, we might tell you that you're going to do 3 sets of 8 repetitions, which would require you to do 3 separate sets of 8 repetitions with an assigned rest period. If following this routine as written, you'll have about 30 seconds rest in between each exercise, which should take you a total of about 15 minutes to complete. So this is the first list of our phase 1 exercise, and the first exercise I'm going to talk about right now is the snap down with a vertical jump. And the snap down is a critical component to every plyometric exercise we do because it teaches the athlete how to get into a power position, how to get in the right position in order to explode off the ground with their knees forced out slightly and they're in a strong base.
Hi, I'm Nicole Rizzo. I'm a junior defenseman on the Stony Brook women's lacrosse team. Hi, my name is Deanna Weisenberger. I'm a junior defenseman on the Stony Brook women's lacrosse team.
Go.
So while they're doing this exercise, things that we're looking for, that they're going to reach tall, they're going to bend down into a half squat, and they're going to land after the jump nice and soft. Things that we don't want, knees in, we want the knees out while they jump and land. We also want to make sure when they land that they land with bent knees and we're not landing with straight legs. As you can see from the side, they lean back and they land and their butts are back. We have a positive shin angle, but our knees aren't going over our toes. They're landing soft, looking athletic. Again, if we watch here, when she squats and lands, the knees are in a good position. They're forced to the outside. When we land on this side or take off in the landing, the knees are a little to the inside. That's what we're trying to correct. So corrective cue is going to say push your knees to the outside. Our final view here is going to be the right way versus the wrong way. So you're going to show you at the same time what the proper exercise looks like and some of the cues to correct the exercise if your athletes are doing it incorrectly.
Ready? Go.
As you can see there, we landed a little bit too far forward versus over here where we landed nice and soft in a good athletic position.
The next exercise is forward hurdle hops, and this is a linear plyometric exercise where we want our athletes to be able to jump and land while moving forward, which happens often in sport. So we want to teach our athletes how to land properly, absorb force, and then repeat that movement.
If you don't have a lot of equipment available to you, don't worry. You can still do this activity perfectly fine. On the left, we'll have, or your right, this will be a forward hurdle hop, just onto the ground, moving forward. Over here, we have a piece of equipment that she's going to jump over. She's going to clear and land athletically and soft.
Ready? Go.
And back up.
Ready? Go.
As you can see, they both land nice and soft. They're moving forward. We're looking athletic. Our knees are forced out.
Go.
Our knees are bent on the landing. All good mechanics.
The next exercise, a cone deceleration drill, is really, really important. Decelerations happen over and over and again in all sports, whether you're a softball player or a lacrosse athlete or a soccer player. You're sprinting, you're stopping, and then you're starting again. And a lot of the deceleration work that we do is in an effort to get you to stop properly without losing balance and put you in a position to be able to plant and change directions quickly.
In this exercise, we have our cones set up. What they're going to do is they're going to 75% sprint out, and we're going to stop before the cone. We're going to make sure that we stop our feet, we control our body, and we're not falling forward or falling backwards.
Ready? Go. 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 The next exercise is the eccentric squat, and again, all of our exercises are used with just our body weight, so you don't need any equipment. And the eccentric component is really teaching our athletes how to do the movement correctly while also getting strength in positions that you're going to need for sport. So the eccentric component refers to the way down. So as we're squatting, we're going to take 3 seconds on these exercises, 1 1,000, 2 1,000, 3 1,000, to get down into the proper position before coming up.
Ready? 1, 2, 3, up. Good. And again, 1, 2, 3, up. And one more. 1, 2, 3, up. Again with this, just like the first squat exercise, we're making sure that the knees are forced out. We're making sure that they stay balanced. A little bit of positive shin angle, which means if I'm from the side, our shins are slightly forward. Not so far forward, my knees are over my toes, but forward enough where I can push forward and be athletic. Knees are pushed out, weight is balanced, and they're standing up right in their spot.
The next exercise is the eccentric split squat, and a split squat and single leg work in general is really, really important for preventing ACL injuries. You'll see in this program there's a lot of single leg work. This one is a quad dominant single leg exercise where our focus is getting on is strength on both sides becoming equal.
This exercise, since it is done each leg at one time, you will do the same set and reps on each leg, just as a note. And what we're going to do is they're going to go down to the same count of 3, and then they're going to stand up back to their resting position. All right, ready? And 1, 2, 3, up. Good. 1, 2, 3, up. And 1, 2, 3, up. With this exercise, we want to make sure that if we're looking at the side, they're not too far back where our back leg is way back here. Everything stays underneath. We bend down, and we're coming straight back up. Not leaning too far forward, not leaning too far backwards. Everything is nice and balanced.
The eccentric hip hinge is an exercise pattern that we're going to use a lot over the course of the next 2 phases. So the eccentric hip hinge, we're teaching our athletes how to use their glutes and their hamstrings properly, which are important muscles for preventing ACL injuries.
We're going to go back down into the position for a count of 3, and then they're going to stand up back to their normal resting position. Ready? 1, 2, 3, up. Good. And again, 1, 2, 3, up. And last one, 1, 2, 3, up.
The eccentric glute bridge is the final exercise on day 1, phase 1. And the eccentric glute bridge is a really important exercise to get our glutes firing, which is really important for ACL prevention. And the eccentric component adds a little bit of a high intensity addition to the exercise.
They're going to start lying on the floor. The start position is going to be hips up in the air. You guys can go ahead, get in the start position. And we're going to go down for a count of 3. Ready? 1, 2, 3, up. Squeeze. Good. Make sure you're engaging the core, you engage the glutes, and down. 1, 2, 3, up. Last one. 1, 2, 3, up. Good job.
So the first exercise in phase 1, day 2, is the snap down with a lateral hurdle hop. And I've referenced the snap down and how important that is to get into a proper position for plyometric activity. We talked about linear plyometric exercises in the first phase. Then that's next day 2, we're going to move side to side. So change of direction laterally. So this exercise is going to teach us to be explosive, jumping side to side, but also emphasize the landing piece when we emphasize that in our movement.
You guys ready? And reach. Go. Good. And back. Reach. Go. And back. Last one. Reach. Go. Good. What we're looking for is making sure that we're getting a nice high reach, a good bend in the squat, and when they jump over, we're landing all controlled together. Again, same position, knees are out. We're making sure that we're balanced. If you have someone who's unbalanced, we may need to slow it down or make sure that they correct themselves as we go.
The next exercise in our program on phase 1, day 2, is the snap down with a 90-degree hurdle hop. And in sport, a lot of times athletes jump up and they land in a different direction than they took off in, landing in facing the opposite direction or facing at a 90-degree angle. So we want to get our athletes comfortable jumping and then landing in a different place.
So they're going to reach up, they're going to snap down, jump straight up in the air, and we're going to land facing that way. Ready, reach, go. Good, and again. Reach, go. Good, last one. Reach, go. Good job.
The skater drill, in-space skater drill, is a really important exercise for teaching change in direction. The deceleration drill we taught on day 1 it works on linear progression, sprinting and stopping, where this skater drill teaches our athletes how to get in their proper position to move side to side, which is obviously very important for our field sport athletes.
We're going to starting on one foot, and we're going to jump laterally to the other foot. The object of this is to land nice and balanced on the single leg, but also being able to go from single leg to the other leg, side to side, nice and controlled. So we're going to start on our left foot. We're going to the right. Ready, go. Land, be balanced. That's okay. Get your balance first. It's okay. Ready, go. Ready, go. Last one, ready, go. And relax. This exercise can be a little bit more challenging. It's very important that when we're teaching this and we're cueing it, when they land, we want everyone to be balanced. If you're falling all over the place, give them a second, get your balance before you do the next rep. Otherwise, all we're doing is teaching improper mechanics, balancing, and body control. We want everything to move side to side, all together, athletically.
Similar to the eccentric squat, the pause squat is going to teach our athletes how to get in the right position. And eccentric strength training and isometric strength training has been shown to help increase intensity and also help reduce the likelihood of ACL injuries.
They're going to start standing, they're going to go down into a squat position, and we're going to hold it for a count of 3. You guys ready? And go. 1, 2, 3, up. And again, go. 1, 2, 3, up. Last one, go. 1, 2, 3, up.
The pause standing hip hinge is a repeat of our day 1 eccentric hip hinge. Instead, we're going to pause at the bottom of the exercise for 3 seconds before completing the repetition.
And ready, go. 1, 2, 3. Good. Again, go. 1, 2, 3. Good. Last one. Go. 1, 2, 3. Up. We're looking to make sure that they're not sitting too far back, that our knees are slightly bent. We look nice and controlled here. We're not falling forward or weight is too much on our toes. If that happens, that's okay. Take a break, correct the activity, and then we'll move on.
The pause split squat, again, is a very important exercise for teaching athletes the importance of single leg strength. And the pause at the bottom is going to increase intensity and get our athletes stronger in that bottom position, which often happens in sport.
And ready, go. 1, 2, 3, up. Good. Again, go. 1, 2, 3, up. And last one, go. 1, 2, 3, up. And this activity, since it is single leg, you will do the same amount of reps and sets on each leg.
The pause glute bridge is going to be done the exact same way we did our eccentric glute bridge, except you're going to squeeze your glutes at the top position before coming back to the starting point.
Ready, go. 1, 2, 3, down. And go. 1, 2, 3, down. Last one, go. 1, 2, 3, down. On this activity, we want to make sure that the hips and legs are at a nice angle. Our feet aren't too far out in front. They're nice and underneath. Their heels are going to dig in. They're going to shoot their hips up as high as they can and really activate and squeeze your glutes while also keeping your core nice and tight.
And that concludes phase 1, day 2 of our ACL prevention program. Now I'm going to introduce phase 2 of our ACL prevention program with day 1. And the first exercise is a snap down with a tuck jump. And the difference between the snap down and vertical jump and the snap down and tuck jump is the tuck jump, we want to reduce ground contact time. So as we're jumping up and our feet hit the ground, we want to explode back up as quickly as possible, which increases the intensity of the exercise.
And ready, reach, go. Good. Again, reach, go. And last one, reach, go. And that's okay. Sometimes you might get to the end, you might be a little fatigued. If you can't get all the way through, that's okay. You don't have to jump the highest. We want to see consistency. Get the knees up off the ground, get them back down and land. If you can tuck them in really high, that's great. If you can tuck them in halfway, we'll work from there and we'll get better as we go.
The next exercise is a single leg broad jump with a double leg land. And single leg strength training is important. It's equally important to do single leg plyometric exercises. So this first phase, we're going to jump off of one leg and land on two. And similar to a lot of the exercises we're teaching, these are patterns and movements that occur in sport. So we want to do them in a controlled environment and teach you how to do them correctly. So when it happens live, you're prepared for that activity.
Again, this exercise, since you're starting on one leg, you're going to make sure that you do the same amount of sets and reps on each leg. And ready? Go. Good. Come back. Ready? Go. Last one. Ready? Go. Good. We're making sure that through each rep, they're starting, they're going to propel out as far as you can. If you can't jump super far, that's okay. Each time you do it, we want you to try to get a little bit farther so that you increase that distance. When we land, we're landing nice and soft, both feet coming down with the knees bent and landing and looking athletic.
The next drill is a cone deceleration drill, where instead of just stopping at each cone like we did in phase one, we're going to sprint up and around each cone to decelerate our body, come around the cone and backpedal, and then accelerate again.
Ready, go. Notice they're clearing the cone each time. We're not stepping on it. They get their feet all the way around, and then they're running through.
The isometric pulsing squat's the next exercise, and the pulse at the bottom position is going to increase the intensity from phase one to phase two, so we continue to adapt and get stronger, and use this as an exercise to progress into phase three, which we'll share in a moment. Ready? And go. Notice they're staying nice and balanced. Our knees are pushed out to the side. We're not getting too far forward.
And then once they're done, they will stand up and complete the activity.
The next exercise is called the eccentric single leg RDL, and this is a really, really important single leg exercise that works our posterior chain. And single leg training and eccentric training are both critical for preventing ACL injuries.
Again, since this is a single leg activity, make sure you do the same amount of sets and reps on each side. Okay, you ready? On my count, go. 1, 2, 3, up. Make sure you guys really bend at the hip, lean forward for the count of 3, and go. 1, 2, 3, up. Last one. 1, 2, 3, up. Some of the cues we're looking for is to make sure that they go down nice and flat. We want to make sure that they're not turning their hips out, going too far forward and falling over. We want everything nice and controlled. If you can't bend down that far, that's okay. Go in the range that you can deal with, under control, and then the next time you do this, try to go a little bit farther.
The next exercise is the single leg reverse lunge, which is a great exercise for strengthening quads and our glutes, and it's got the same value as the single leg RDL that works different muscle group.
Whenever you guys are ready, start. You're gonna step backward into the lunge, stand back up, and then alternate legs. Ready, go. Good job.
The next exercise is the single leg glute bridge iso hold. And we're progressing from phase 1, where we had a double leg glute bridge iso hold, to a single leg variation in this next phase.
And ready, go. Good, we're gonna make sure that we kick the leg straight out. Hips go as high as possible. Squeeze and hold. Relax. Good, and switch legs. Ready, go. There we go, kick it straight out. Hips high, squeeze the glutes. Relax. Good job.
That concludes phase 2, day 1. The first exercise on day 2, phase 2, is a lateral hurdle hop and a vertical jump. And this combines 2 exercises, and we're gonna explode over a hurdle and then explode immediately into a vertical jump, which combines 2 movements, which advances the exercise.
Ready, go. Good, and back. Ready, go. Good, one more. Ready, go. Good job.
The next exercise is called the 90-degree hurdle hop, and this is an important rotational plyometric exercise that we're going to emphasize in phase 2 and in phase 3 of the program.
Again, if you have equipment, that's great. If not, you could follow along right here with no equipment. Make sure that we're landing softly, we land with the knees bent, and then we're exploding up into the air as much as possible. Ready? And go. Good, again. And go. Last one. And go. Good. Again, the object is to land. We're working on some mechanics, landing and exploding. If you can't jump that far out, that's okay. If you can't get your knees all the way up, also okay. Do your best, and the next time you do it, just try and get up a little bit higher and knees a little bit higher to your chest.
The next exercise is the skater drill, which we did in phase 1, but we're going to combine that with a crossover run. So we're going to do the exact same exercise we did in phase 1, but immediately go into a short 5-yard crossover run to emphasize coming out of that position.
Ready, go. Good. Ready, go. Good.
The next exercise is a staggered stance squat. So you're going to have your feet slightly staggered and go down into a squat exercise, which again puts you in a position that often occurs in certain sports that require lateral movement.
And this is going to be just for reps. So ready, go. Good. And once you finish, then you will switch and do the other side.
The next exercise is pause single leg RDL, and similar to the eccentric variation of this exercise, we're going to do the same thing, but we're going to pause at the top opposed to doing it slow on the way down.
Make sure that you do the same reps and sets on both legs. All right, ready? And down. Good, hold. 1, 2, 3, up and down. Good, hold. 1, 2, 3, up. Last one, down. Hold. 1, 2, 3, up. Good. When we're doing this, again, when they get down to the bottom, make sure that everything is square, slight bend in the knee. We want to make sure our hips aren't turning out, they're not losing their balance. If that's the case, don't bend down as far. Work in the range that you can hold controlled for the entire 3 seconds.
The next exercise is a drop step lunge. Again, a very, very important single leg exercise, which we emphasize a lot in this program. And you're going to drop step at a 45-degree angle and lunge deep down into that position to strengthen your groin and your hamstrings.
Ready, go. Lunge, good, and back. And other side, good. Again. And last one. Good, and back. We're gonna make sure that when you step back, you're opening the hips up. We're stepping out and lunging, but make sure that you can keep your body underneath you. If you go too far away and your foot's up, we're not controlled, it's not a good lunge. Keep it in. Bend, make sure we got a positive shin angle. We're not going too far over the toes. We bend our weight back, step back up into the start position.
The walking glute bridge is another single leg variation, which is going to emphasize posterior chain strength and core strength as part of this routine.
Ready, up, go. Good, settle and bring them back. And relax. This activity is pretty advanced, so take it slow. Go do the best that you can. Get as far out as you can, controlled, but make sure you keep those hips up and the glutes tight.
And that concludes phase 2, day 2 of the program. So this starts phase 3 of our ACL prevention program. And in phase 3, these exercises get more challenging and more advanced. And the first exercise is a double leg tuck jump into a single leg land. And landing on one leg is critical in all sports because it often happens in events like volleyball, soccer, or lacrosse, where you may jump up or you may change direction, and oftentimes you're landing on one foot. And this exercise really helps reinforce that with the right technique.
If this activity is too difficult for you, you can stay on phase 2, or you can do a tuck jump into a land on 2 legs. Okay, guys, you ready? And go. Good. And do the other side. Ready, go. That's okay. One more time. Really focus on landing. If you can't get your knees all the way up, that's okay. When you land, the landing is the most important. We're gonna land nice and stable and balanced. If you need a little extra time in between, please take it. Ready, go. Good job.
The next exercise in this program is repeat broad jumps. It's a really important exercise to develop explosiveness and lower body power.
Make sure when you land, as soon as you hit the ground, jump right out into your next rep, slow and controlled. If you need it, if it's too advanced for you, please hold in between and then repeat the next rep. If you're good to go, make sure you jump, land, jump, land, jump, land. You guys ready? And go. Good.
The next exercise is a reactive deceleration drill, where a coach or a partner at your training session will call out different colors or numbers to increase your reaction time and also enhance your change of direction abilities.
Ready? Go. Red. And walk back. Make sure you mix it up. If you don't have colored cones, you can set out 3 or 4 different items and just do a number. And go. Yellow. And back. Go. Blue. Good job.
The next exercise is the eccentric rear foot elevated split squat. And this exercise is really challenging, but also very, very important for improving lower body strength in all athletes.
So you can use a bucket if you're on the field, you can use a bleacher, a bench. If you're in your house, you can use the couch. Just make sure your rear foot's gonna go here, then we're gonna go down for a count of 3 and return to the start position. Okay, ready, go. 1, 2, 3, up. And go. 1, 2, 3, up. And again, for this activity, since it is single leg, make sure you do the same amount of reps and sets on each leg.
The eccentric single leg RDL with knee drive is our next exercise. And this exercise is the exact same movement we did in phase 2, except this time when we come up at the top, we're gonna drive our knee up, which is gonna increase our balance and coordination.
Okay, ready? And down. 1, 2, 3, up. Good. And let's do the other side. Down. 1, 2, 3, up. Good. Again, it's important to maintain proper alignment. If you can't bend too far forward, that's okay. Get as far as you can controlled. Stand up. Drive that other knee up into your chest as high as you can. It is a single leg activity, so make sure you do all the reps, all the sets on both sides.
The isometric cross under lunge is a great glute strengthening exercise that challenges the athlete in balance and also lower body strength.
All right, so our first one, we're gonna stand on the right leg, the left leg is gonna move behind. Ready, go. And hold, make sure we're nice and controlled. We're not too far spread away from ourselves, and up. And other side. Ready, go. Good, bend, hold. Get in the position as deep as you can, controlled, balance, and up. Good job.
The last exercise in phase 3, day 1, is the Nordic leg curl exercise. And this exercise has been proven to not only reduce the likelihood of injury, but also reduce the likelihood of soft tissue hamstring injuries. And this is an important exercise for not only female athletes, but for male athletes also.
Hopefully you have a partner. If you don't, please make sure you're supervised. You can try and snug your feet underneath a couch, under a bed, or something low. You can put some weight on your feet. Partner's gonna hold the legs down. She's gonna slowly lower herself down to the ground, hands down first, do a push-up, and return into the position. Ready, go. And again, slow and controlled, really focusing on the hamstrings working, curling back up, and the glutes. Good job.
This concludes phase 3, day 1 of our ACL prevention program. The first exercise in phase 3, day 2 of our advanced ACL prevention program is the lateral single leg hurdle hops. And single leg hurdle hops are an awesome exercise for both the ACL prevention, stability, and balance on one leg.
Ready? And go. Good, and back. Really focusing on the landing. This is a big one with the knees, so make sure our knee isn't gonna pop too far in. We're not gonna force it too far out. We're gonna land and be nice, balanced, controlled. Ready, go. Good, last one. Ready, go. Good job. If you lose your balance, that's okay. Start over, try it again. Make sure, since it's a single leg activity, we're gonna do the same reps and sets on each leg.
The next exercise is repeat 90-degree hurdle hops. And just like we did in phase 2, we're gonna use the 90-degree hurdle hops as an exercise to improve how we land after we rotate in the air. And the way we make this exercise more challenging is by having it be repeated. So you're gonna go back and forth as quickly as possible during this one.
If you have equipment, that'll be the first one. The second example is gonna be if you have no equipment. Ready, go. Good. Ready, go. Good. The focus of this is making sure that you get your body up and around. We're turning and landing, and we're switching direction so our body has to accommodate. Try to get your feet up as much as you can to clear the hurdles or whatever you're jumping over. If you hit them, that's okay. The next time you do it, just try to make sure you get your feet up and over.
The reactive shuffle drill is just like the reactive deceleration drill, except for we're going to be moving side to side, and a coach or a teammate is going to be calling out colors or numbers, so you have to think and then react as quickly as possible.
Make sure you do same amount of shuffling both directions since you can only shuffle one way at a time. Ready? Blue. Red. Orange. Blue. Red. Good job.
The next exercise is the pause single leg RDL with knee drive. So it's just like it was in phase 2, where we're going to go into a pause single leg RDL, except this time we're going to come up and drive our knee up to increase our balance and stabilization.
So let's go left leg first. And go down. Good, hold. 1, 2, 3. Knee drive and down. Right leg. And down. Hold. 1, 2, 3. Knee drive. Good. Again, just like our other RDL activities, make sure that you lean forward to the best of your ability. The farther down you go, the more difficult it will be. We're going to hold and control. Make sure your hips and your leg isn't turning out all over the place. Be balanced. Then when you stand up, knee drives up high and then back down.
The next exercise is the lateral lunge. Just like our drop lunge and our reverse lunge, single leg strength is really, really important, but this is going to train us to be strong side to side, which is important for change of direction.
And go. Bend, return. Good. Left, go. Right again, go. Last one, left, go. Good. We're going to make sure that we're not going to sit too far back, that our chest goes down to the ground. Butt sinks to the floor. We step out, controlled, good positive shin angle, good bend at the knee, but our knee does not go over the toes. Then you're going to control, return to the start position.
The last exercise of our phase 3, day 2 ACL prevention program is a cross under lunge. And it's another really challenging single leg exercise that improves glute strength and hamstring strength.
Ready? Go. Good. Back up, other side. Make sure you're balanced. We're stepping and we're staying nice and controlled. The leg goes underneath without getting too far back. And again, the left leg is going to go under first and go. And other side. Good job.
That concludes our ACL prevention program. We're really excited and proud of what we presented to you today. It's a combination of current research and our work that we currently do at Stony Brook Athletics with our student athletes, our sports medicine team, and athletic performance team.
Awesome. Thank you so much, George, for the great video. Thank you to BJ for giving us the athletes examples and everything. You guys did a great job with this. Before we get into a time for questions, I just wanted to leave George's bio up in case you needed to see credentials or what he brings to the table here. And he's got a lot of education, a lot of years doing what he's been doing, and he's put together a great program for Stony Brook to follow. Our other star of the show was BJ. BJ is an assistant athletic trainer at Stony Brook. She does a lot with the athletic training staff and the team members. So if you have any questions for her, feel free to ask as well. If you have questions, type them in the chat box. You can put them into everybody, or you can type them individually to myself. Let me go back. I just realized that I didn't share those two with you guys. There we go. So this is just the slide for George. And we have for BJ as well. I know throughout that video, some people who are watching on their iPhones or on a tablet, the video was a bit delayed. We will be posting this video to the Stony Brook Medicine YouTube channel. If you're watching on a laptop or an iPad, it doesn't seem like it was any delayed, but some people were having some issues off of their phones. So you can have the opportunity within the coming week to watch it again on the Stony Brook Medicine YouTube channel. While people are putting in their questions here, I just want to briefly go over the Women's Sports Medicine Center team. We will have another webinar next month, which I'll have an advertisement up for, and you can get to know the Women's Sports Medicine Center team a little bit better and get to know what they're all about. So we have Dr. Penna, who is the chief of our sports medicine service and team physician for Stony Brook University Siebel's athletic program. I'm not going to go deep into all these members' bios, but I just wanted to give you a little bit of an example and see what the team members have. We have Dr. Hopkins. We want to welcome Dr. Hopkins to our team. She just joined Stony Brook, and she is a fellowship-trained orthopedic surgeon specializing in sports medicine. She's currently out of Southampton, but she is the director of the women's and sports medicine team. So welcome aboard, Dr. Hopkins. We have Dr. Cherney, who's one of the first sports medicine specialists on Long Island. Dr. Cherney has a lot of years of experience, and he's done a lot of research, helped out a lot of sporting events, and a lot of people do know him just by his name. So thank you, Dr. Cherney, for all your hard work with putting this program together with George and BJ as well. We have Dr. Cruikshank, who's a family medicine physician in the Department of Orthopaedics and non-surgical sports medicine. We have Dr. Mayo, who is fellowship trained in hand and wrist surgery. Dr. Samantha Mulrad, who is orthopedic surgeon in hand surgery as well. Dr. Patterson, who's one of our orthopedic surgeons. Dr. Paulus, who is our foot and ankle surgeon. And our lovely physician assistants, Jennifer, Robin, Jane, Michelle, and Maria. So those are just the members of the Women's Sports Medicine Center. As I was saying, on December 8th at 7 p.m., we are going to have a Women in Sports Medicine topic webinar for you. So we will be bringing in multiple different healthcare fields and professionals to help you better understand the ins and outs of their healthcare field. You can register for that on the Stony Brook site. That shortcut on the bottom, that bit.ly, is a shortcut to the registration page. And similar to tonight's webinar, the registration will close the day before, so I can make sure I send out the link to everybody. Take a peek at some of these questions here. With the PowerPoint presentation, we do have a question on that. We will be posting a PDF file of the exercises that George and BJ went over with their athletes. We'll be looking to post it on the Stony Brook Orthopaedics and I believe the Stony Brook Athletics page. George, I know you had some connection to that as well. Everything that we post to the Stony Brook Orthopaedics YouTube or the Stony Brook Medicine YouTube just has to get approved by marketing. So there is a few days delay before it does get posted to the public. The recordings, once you watch that YouTube, it's not eligible for the educational credit. That's another question we have here. And one more question. If you're logged in as an iPhone, I need to just know your full name. So I know you can change, I gave the access to everybody to change their names when they signed in here. So if you are logged in as iPhone or tablet, please just change your name so I can confirm for the attendance list. We have a question here. Has there been any short-term or long-term outcomes data on incidence rates and the reduction? We have, there we go.
I can address that.
Sure.
So there are about 6 or 8 well-known ACL prevention programs out there right now. The PEP program is one of the oldest. FIFA has a very intricate, complicated ACL program. And there are studies, but they're kind of all over the place as far as how effective these programs are in reducing ACL injuries. But a number of studies point to reduction percentages up to 50 to 80% in athletes who do these programs. And one of the interesting findings in almost all of those studies is that the success rate in reducing the incidence of ACL injuries, especially in female athletes, is related to the exercises being done under supervision. So we can't emphasize enough the importance of having a coach, an athletic trainer, physical therapist, a parent, monitor these exercises, because otherwise it's very hard for the athletes to know themselves, to appreciate their body mechanics. Another thing that George didn't mention is when your athletes are being exposed to these programs, now that we all can video on our phones, take advantage of that, because it's a tremendous advantage for the athlete to be able to see what they look like in the process of doing these exercises. Specifically for this program that was presented tonight, this is actually a relatively new concept, even for us. So we cannot address that question as to how effective it is in reducing injuries. The thrust of this program is to have developed a series of exercises which we've kind of borrowed some from some of these established programs. We've modified some, and we've added a few of our own. And one of the things that we wanted to achieve with this program, with George and BJ's hard work, is to come up with a simplified program that doesn't add that much time to warm up or warm down. 15 minutes, we figure you can get through each one of the programs before or after practice. So one of the things that we want to emphasize is that you can have the best ACL program in the world, but if nobody does it or nobody understands how to do it, it's not going to work. So we feel that by kind of simplifying this program, by putting out the video tonight to show exactly what the proper mechanics should look like, we feel confident that it will be successful in reducing ACL injuries, but only long-term follow-up would be able to answer the question as to how effective it is in reducing the overall incidence of ACL tears.
Thank you, Dr. Cherney. I have an interesting question here. We are looking, and I laugh at this because I know we have a few different sports physicians who have different opinions on it. Graft choice for a young female athlete who does tear their ACL. Who wants to go first? Dr. Cherney, I know you like your specific graft choice.
Yeah, we're all over the place. So I'm a patellar tendon BTB guy, but it depends on the sport. It depends on the age of the athlete. So in a fully mature female athlete in a high-risk sport, I would always recommend a patellar tendon BTB first, but quadrupled hamstring tendon is a really good operation. And I know Dr. Penn is on, and he goes to that a lot. So they're both good options. Overall success rate in getting back to sports is about the same. Each one has a little plus and a little minus to it. So it's still kind of dealer's choice. It's across the country right now, it's still pretty close to 50-50 among sports orthopedists as to which graft they prefer. We would never recommend allografts or cadaver grafts if they can be avoided.
Wonderful. And a question, and have any cases been performed using quad tendon graft?
Have I?
I don't know if anyone's big at that at our practice. I don't believe so.
Quad tendon?
Yeah.
Quad tendon is not a new ACL reconstructive procedure. It actually has been around since the 40s. It's not a bad operation, and the theory is that by taking the quad tendon rather than the patellar tendon, that you will impact patellar tracking to a much lesser extent. I'm not certain that's true. I still like bone on both ends of the graft, but with the fixation techniques that are available now, we can get good tendon to bone fixation on the tendon side of the graft. So I think I would consider quad tendon grafts for revision. ACL surgery, I still would not, I would not use it as my primary choice.
Yeah, and just to build off of what Dr. Cherney just said, I think one of the nice parts about quad tendon is that the harvesting technique has become a lot slicker with new technology. So I think that's causing people to bend toward considering it as a primary graft choice, where maybe before it was used primarily for revisions. The incision is quite small, so I think maybe as the literature catches up to the technology and people see more reps of it, it may become a more common choice in the future.
Thank you, Dr. Hopkins. And Dr. Cherney there. We have, let's see, this question is more probably geared towards George, just at the strength and conditioning aspect of it. Is heavy squatting suggested for female athletes under the age of 13, or would you steer them away from it?
Yeah, at that age, I would steer them away from heavy squatting. I do think the squat pattern still is really important, and body weights, mini bands. You know, an athlete at 13 years old can certainly progress to some sort of external resistance through those means, but I would not recommend heavy box squats for that particular age group. Good exercise pattern, just not necessarily that particular movement.
Okay, thank you. And another one, just with the early younger female athletes, how early do we worry that a female athlete can or will tear their ACL with certain movements? We've seen them at all ages in our practice, but.
Yeah, I can take this because this is part of the talk that I gave a couple months ago. You start to see the rise at age 11. And so for girls, that's right around, you know, an average age for puberty. So right as they're going through rapid growth, that's when you start to see the rise in anterior cruciate ligament tears. And that increase, especially compared to their male counterparts, stays in that 3 to 8 time increase up until the age of 22. And once the female athletes hit the age of 22, the incidence of ACL tears in female athletes and male athletes becomes the same. So there is something about the higher risk for the younger female athletes, and which is one of the reasons that in this program, we encourage the younger athletes to start into the phase 1 of this program, because it's important for them to learn these basic concepts, number one, and I think it's important for them to get used to doing these exercises as part of their sports.
Awesome, thank you. Do we have any other questions? And once we have this PDF, I know George is working on that. If anyone has any questions, you can email me also. I know if you have trouble finding it on our websites on the Athletics or Orthopaedics, feel free to email me. My first and last name, so Dana, D-A-N-A, period, Bennett, B as in boy, E-N-N-E-T-T, at stonybrookmedicine.edu. I will send it to you if you shoot me an email as soon as I have it. All right, if I don't have any other questions coming in, just a reminder for our physical therapists and our athletic trainers to get your credit for this webinar. Please, physical therapists, email Patricia Lamb. These emails were also in that link that I sent for the Zoom meeting last night, I should say. So please make sure in order to get your proof of attendance, you email your prospective individual. So physical therapist, Patricia, and for athletic trainers, Christos.
And Dana,
yep.
And Dana, thank you so much for all your help.
You're very welcome. Thank you, Dr. Cherney, and for everybody. For future webinars, we do have the one in December for everybody. So if you have any input or if you'd like to see something different, if something didn't work for you, you have some suggestions, Feel free to write that in the survey that the School of Medicine sends to you at the completion of this. Please be patient with the attendance certificates. Each Patricia and Christos and the CME office are doing a lot to help with our webinars. So just give them a few days. And a final reminder that we do have the orthopedic urgent care for Stony Brook. Our locations for our practice. So we are located in East Setauket, Comac, Hampton Bays, Patchogue, and Stony Brook. We have to get Dr. Hopkins' information on here as well for everybody. All right, with that being said, thank you for attending our webinar tonight. If you would like to schedule with one of our sports medicine physicians, please call our appointment line. Our next webinar, Women in Sports Medicine, will be held on December 8th at 7 p.m. via Zoom. Registration is open on the Stony Brook CME website. Any other questions or concerns, feel free to email me. Other than that, I hope everybody enjoyed the webinar this evening. Thank you again to our presenters and to our sports medicine staff. We look forward to seeing you for our next webinar in December for the Women in Sports Medicine team.
Thank you, Dana.
Thank you. Have a good night. It's all done and everyone loved it, I know. I got a
Great.
few positive comments already over here and that's great.
Awesome. Thank you so much.
Not a problem.